Hi, everyone. Welcome to our next edition of our COVID Community Connections. My name is Brooke Smith, and I'm the CEO at United Way here in Lebanon County. And I'm happy to have two guests here with me today to talk about how the COVID-19 pandemic is affecting our senior population here in Lebanon County. And so if you ladies want to take a minute to just introduce yourselves, share what organization you're from, and what type of services you provide to the community would be great. And we'll start with Carol.
Hi, I'm Carol Davies. I'm the administrator of the Lebanon County Area Agency on Aging. Our agency has been in the Lebanon County community for nearly 50 years in one form or another, and we provide a full continuum of services that benefit older adults. Our base funding is provided by the Pennsylvania Lottery and the State Department of Aging, and we have what we like to think of as a continuum of services that benefit people as they grow older. We have activities for seniors who are independent and mobile and don't really need a lot of assistance. So we have things like our Senior Center program and our Apprise Medicare counseling program and our volunteer opportunities. Then as seniors perhaps become more needy, we have services that stem from our care management unit. We provide home delivered meals, assistance with personal care. We provide adult daycare. We have older adult protective services and assessments for people entering a nursing home. Through all of that, we provide information and assistance to people. We take a lot of calls every day for people asking all sorts of questions related to whatever needs they might find as they grow older.
Great. And how about you, Lori? Do you want to introduce yourself?
Sure. Hi, I'm Lori Brandt. I'm with the Albright LIFE program. And the program in Lebanon County has been around since November of 2011. And the focus for what we do to serve the Lebanon community is we work with individuals 55 and over who are basically living in an independent living environment. And we try to help them and provide a multitude of services in order to keep them living in that independent living environment with so they're 55 and over, living in Lebanon County and meeting the criteria for our program. We try to serve them and keep them out of the skilled nursing arena, and hopefully also out of the emergency rooms, and try and help them manage their care with the LIFE program, supporting them.
Great. Carol, I'm curious from your office's perspective. I know you said you kind of take a lot of phone calls about different issues across the county related to seniors. And so what are some of the top needs or things that you've seen kind of bubble up in the senior population during this pandemic?
I think some of the things we see are the same things we always see. They're just colored a little differently because of the social isolation and what's happening. For example, one of the problems that we've had even before the pandemic, but we continue to see, is that people who are in need of in-home personal care have trouble getting their services because there has been a lack of service workers. Mm-hmm. And now with the pandemic, a lot of the workers have maybe children at home with them, so they're not able to work anymore. Mm-hmm. Similarly, one of the things we continue to get a lot of calls about is income taxes. We usually have volunteers in our office this time of year who assist people file their taxes. Mm-hmm. We have volunteers who help people with their Medicare, and we also have volunteers who help people apply for the property tax and rent rebates. So all of those things are not happening right now, and that's, people just are frustrated by that, and they want to make sure that they do the right thing and get their forms filed, so they're looking for assistance there.
Yeah. So right now, a lot of the county offices are actually closed to the public. And so how is your team still kind of connecting and able to serve those, even though maybe they can't physically come into the office?
What we're trying to do right now is balance the request of the county that staff stay home and stay safe with the what we consider the mission critical functions of our agency. So we're continuing to deliver our home delivered meals Monday through Friday. We continue to provide protective services. We continue to offer intake and referral for our most critical service, and at this point that is the home delivered meals, because that is what we're considering a life-sustaining service. Mm-hmm. And we're also trying to reach out to our consumers who are socially isolated. So we're trying to do that as best we can. We do currently have limited staff in the office. Other staff are trying to work from home. Many of them are using their own personal computers. They're using perhaps their own cell phones to stay in touch with people. And I really give them all a lot of credit. It's been a tough balancing act.
Yeah, I mean, I think everybody's trying to transition to this new digital world and connect with people the best way they can. You know, you spoke a little bit about Meals on Wheels, and I know that's a real critical program for the seniors in our community. Just a ballpark, do you know how many folks you typically serve through that program?
Typically, we deliver personally to about 250, 260 people a day. We have another 75 or so who receive their meals through a once every 2-week delivery. But there's 250 people that we deliver meals to every day. And right now we have a mixture of some paid drivers and actually a nice large number of volunteers who go out every day to deliver those meals to people. And you know, we've instituted measures to keep them safe. We are not physically handing the meal directly to the consumer anymore, but, you know, we're placing it on the table or on the table on the front porch or finding a way that we can still make that check and make sure that person is okay, but still get them their meal.
Yeah, that's great to hear. You know, I think we've seen a lot of volunteers kind of step back because many of the volunteers in our community are from the senior population or folks who are retired and, you know, for their own physical health protection, they've stepped back from some of those volunteer opportunities. But I feel like there's been a lot of others that have stepped up who are physically able that want to give back and help. So that's really reassuring to hear.
Go ahead.
Are there other food programs that supplement the Meals on Wheels for seniors that might have some food insecurity?
Currently, there's also the food bank, and I would say that's generally the other option. I know there are a lot of grocery delivery services being offered now that can also supplement and help people get meals without leaving their home.
Yeah, great. And you were going to make a comment about volunteers. Anything else you wanted to share?
Oh, I just wanted to say we actually had a volunteer who had other volunteer opportunities that kind of dried up in the stay-at-home order and offered to volunteer more. We have had other offers of volunteers stepping up to the plate. So we're really very pleased right now. Our volunteer coordinator is in contact with the volunteers regularly. And right now we have a good schedule of volunteers through the next few weeks.
That's really great. That's great to hear. So anything else that you are doing or your office is doing to help just empower these seniors to continue to kind of live independently despite this isolation factor?
One of the things that our staff is doing is we're reaching out to people in the community who we are already in touch with. For example, our senior center managers are reaching out to some of the people who would typically frequent the senior center to make sure they're doing okay, especially those who they may be aware don't have a lot of other contacts in the community. Mm-hmm. Similarly, our care managers are doing the same thing with the people on their caseloads, reaching out and making sure that they have what they need and are okay. We're also providing some information through our website. We're updating it regularly to provide information and opportunities for people to stay in touch and see what's going on.
Yeah, that's great. Great. Thank you. Lori, I'm going to switch to you for a couple of questions. And so tell me how your program has been impacted. I believe the Albright LIFE Center is actually closed as well, correct?
That is correct. So as of March 17th, our center has actually been closed. And with the life model being a large part of it, potentially being the social model, you can, just like everything else, we've been affected. But the team has been awesome in redesigning how we can serve these folks that we have as participants. So we presently have 65 participants that we serve in Lebanon County. And what the team has been doing is been contacting them on the days that they would potentially come to the center, making sure they have what they need. There are some folks who also presently still have some visits scheduled and needed addressed by their care plan. We've been with our staff trying to be very conscious of all of the CDC guidelines and through Department of human services, because those change sometimes daily with us, to make sure that our staff and the participants we see, are both being safe and as they're trying to care for them and meet their needs. But between the RNs, the occupational therapists, and the program assistants, if it's deemed necessary, they have been making those visits to our participants to serve them, to make sure that they're safe in that home environment, as well as making sure meals, supplies, any medications. The team has been having that interaction. I do meet with some of this staff just to kind of hear what's going on with the participants, and they really have been stepping it up and making it fun, where they'll announce through the loudspeaker that they're going to be singing happy birthday and calling that individual. They're playing phone bingo now, so they give them a few numbers each day, and eventually someone will win. So they're doing a lot of fun things like that, sending little encouragement cards, along with the deliveries that they have, and just trying to, because it does, while the needs are truly important, as it goes on, the psychosocial piece has, been impacted as well. So trying to address that with our folks. And basically we've been allowed to keep enrollment flowing as well. So if folks, and I have been getting some referrals, and we've been handling them and just adjusting as we need to with doing things telephonic and following the guidelines for, through the state for that. So we're essential, so we're here. We are, doing everything we possibly can with the masks and the social distancing, and making sure that we keep ourselves safe as well as, our loved ones, but just trying to manage, supporting these individuals in the community as best we can.
Yeah. And so maybe this is a question for both of you. Do you find, I heard you both say that your staff is reaching out to the seniors. Do a lot of the senior population, do they have access to technology like we're using today to have that face-to-face contact, or is it mostly just phone calls that you're making?
We're just making phone calls at this point.
Okay.
A lot of ours don't have the technology. I mean, even if they do sometimes have the phones, they're not equipped to, just like us today, having some challenges to make that happen. So, but they do really, truly appreciate, the personal gestures and, that a little bit extra outreach.
Yeah. Lori, the folks that you're providing services to, do many of them have family locally or other supports they would typically lean on that maybe they can't see during this time?
Right. Initially, when it all started, the team was in touch with the loved ones that we knew, because with the numbers, you really do get to know all the families very intimately. So they made the contacts to determine if there were going to be individuals who could be providing some of those extra needed groceries and things like that. And if there weren't, then we needed to make sure we could provide that. So it just depended, but we do have some folks that we are still going into, because they really, if they had someone, they're really just not involved in their lives. And so that is the role we try to, augment.
Mm-hmm. Sure. So, during typical times, I don't want to say normal, but kind of what was our old normal, you hear a lot about seniors being the target of scams and people trying to take advantage of seniors. And you've also heard some of this come to light now as well during this COVID pandemic. Have either of you had any experiences, helping your senior clients navigate any of that, or any advice you would give to people in that realm?
I have not heard of anybody specifically who has been targeted by one of the scams. We just actually received in our office an update of guidelines for seniors to be aware of related to all the scams. I think the newest place where people are trying to take advantage is with the checks that are supposed to be distributed for the stimulus, and the guidance that we're going to be putting on our website covers that people should not respond to anybody who calls and says they can help them get their stimulus check early or get an increased amount. So that is information that we want to provide on our website.
Great. How about you, Lori?
There hasn't been anything direct that I've heard of, anything specific that anybody's questioned, but when folks do enroll in the program, we really do try to get them to give us a call for any of those things. I mean, of course, it's, you know, they deal with a lot of medical issues, but any of those odd things. And I think for the most part, the majority of them do tend to reach out to us and ask those questions and utilize the team here. So they're really pretty good about that. I haven't heard anything directly. I've seen a few things myself on Facebook. And we also monthly, when we talk to them, there's a lot of things we consistently try to remind them at their participant council meetings to kind of, so this is an ongoing thing because they truly are typically an ongoing target. So we do try to encourage that, you know, make sure, don't do anything, you know, out of the ordinary and question everything.
What else would you like the community to know, either seniors or caregivers who might be caring for a senior in the community during this challenging time? Is there anything else you would like to share that you would like people to know about?
I just think as I'm continuing to do the day-to-day and the emails that I'm getting from our local Lebanon community and the resources that are out there, I think it's just important that, you know, even if you don't know where to turn, just ask someone. Someone will be able to direct you because we have a load of resources out there and people have really stepped up the plate, you know, you folks with United Way as well. It is just, you know, it's astounding what is available and out there. So it's really just, people need to just ask. And, you know, sometimes it is a little persistence until you get, but there are resources. So, and we're always willing to help. So connecting people with the right resources is huge.
Yeah. Carol, anything from your perspective?
I would echo what Lori said. Certainly we do have a community that is close-knit and provides a lot of good resources for people. I would also remind people to take care of themselves and take care of those that they love and that are dear to them. I think there's been a lot of good advice coming out as far as limiting the time that you listen to the COVID news. I think that can wear on anybody and can become depressing. Make sure that you follow your normal sleep patterns and eating patterns, and try to stay socially connected. Even though we're socially isolated, there are ways to stay in touch, whether it's the phone or the computer or even the old-fashioned U.S. Postal Service. There are ways to stay in touch with people and take care of yourselves and each other.
That's great advice. I know it's easy to overlook that, especially when you're in a caring field and focused on caring for other people, but that's a great reminder. Is there anything that the community at large could be doing to help support our local seniors to kind of keep morale boosted and you know, kind of keep them in a healthy place?
I mean, I think if you just kind of, we have a little bit of extra time, most folks, if you're at home, and just even if you wouldn't normally reach out to that older neighbor, someone from church, maybe now is a good time to maybe just implement that and just, you know, reach out by the telephone and give them a call or a short note, because you just never know when you can impact somebody. And you know, with time on hands for a lot of folks, you know, making that little extra gesture would be, I'm sure, much appreciated.
That's great. I would echo that. I think, you know, our community is a really caring community, and I have seen so many people come together during this challenging time. And, you know, just want to remind people too that 211 is a resource for individuals looking to get connected to organizations like yours. So people can always call 211 and talk to a person about what their you know, resources they're seeking, or also texting, you know, their zip code to 898-211. So that's a resource as well. When we post this, I'll also post links to both of your websites if people want more information. And I would certainly like to thank both of you for the work that you're doing for the many seniors in our community and for spending your time with me today.
You're welcome.
Thanks, Brooke.
Thank you.
Thanks for having us.